And welcome back to Eyewitness News. Dr. Mark Simpson with Simpson Dental Associates is here to answer some of your questions. If you have a question for the doctor, you can call the number right there on your screen. But first, before we get to the calls, let's talk a little bit. You guys got a new toy that you've been playing with here.
We have
so
a
tell
new
us about
CT
it.
scanner. We had one of the first ones in West Virginia here, and then we're replacing that machine. And the reason we're replacing it is because the newer machines, they have far less radiation, and in fact, it's very close. The smallest dose that you have is about equal to eating a banana. Isn't that amazing?
That's crazy.
But the whole thing is, if you're going to have a dental implant, you want to have a CT scan prior to that to determine the exact levels of bone. It also helps us in the determining exact angle and the placement and the length and the size. So very important to have that CT scan before you have a dental implant. It's really the standard of care now.
You know, a lot of people call in and they're very concerned about the radiation, so I'm sure that's reassuring to a lot of people.
And that's why we invested in this new machine, is because to help keep people safer and least amount of radiation to get the most amount of information. But that's the key point. You need that information. The other thing I want to mention before we get our first caller is that it's National Children's Dental Health Month. So get the kids to the dentist and get them checked out before age 1.
All right, let's go to the phones. I believe we have Stephanie on the line. Stephanie, good afternoon. What's your question for Dr. Simpson?
I was wanting to know, I floss and I brush my teeth twice a day, sometimes 3. I am a diabetic, but I'm getting cavities at the gum line. They don't form on the top of the teeth. It's always at the gum line.
Right. That's a vulnerable place at the gum line. And I would a little bit question, what is your technique? You know, people say, well, I floss and I brush, but there's lots of ways to floss and brush. So make sure that you're angling your toothbrush at a 45-degree angle on the outside, and on the inside up at a 45-degree angle. And then your floss you need to carry way underneath the tissue. It's going to even be a little bit tender. That lets you know you're getting all the way. But you need to start with a good cleaning first, and then there's lots of products that are available to help diabetics, because a lot of diabetics, they have trouble fighting infection. They have a tendency to have drier mouths, and they have a tendency to get more decay because of those things.
All right, sounds good. Very good question. Let's go to Jessica now. Jessica, what's your question for Dr. Simpson?
Yes, I have a dental implant, but prior to getting the dental implant, the neighbor tooth next to it.
What happened to the neighbor tooth? You still there?
Yes, I'm here.
Okay, what happened to the neighbor tooth?
So it had started to turn, and then I got the dental implant, and that starting to turn.
That'll help hold it there. It sounds like you went a longer period of time perhaps than normal before you got your implant crown, which allowed that tooth to move. Generally, 3 to 4 months is the average, and you won't get so much movement of the tooth in that shorter period of time. But you do want to rotate that tooth back, because now it's out of position and it's going to hit funny, and it can cause more problems.
All right, very good question. Let's go to our next caller. Good afternoon. What's your question for Dr. Simpson? Actually, we don't have any more callers today.
But our dental implant seminar is coming up next week on Tuesday at the 10th, and I encourage you to give us a call. I think we already have like 15 people, but we have room for a couple more. So give us a call if there's any needs you have. A lot of times husbands and wives will come together, even though maybe one of them only needs the dental implant, but then they can help listen and ask the questions that they want answered. So it's a great seminar. Come on down and join us.
That's definitely some education. That's awesome. Dr. Simpson, thank you for coming in today. We had some good questions. Stay tuned for a look at the top story.